Hey, what's up YouTube? What's going on? Back here with a new video, and in today's new video, I have a little interesting discussion that I want to open up today and hear your thoughts about, but also I'm just going to share my thoughts and opinions about this topic. And it's one that may be a little bit controversial to some, specifically those that may be in the medical field. And the topic that we're going to be talking about today is, should personal trainers or strength coaches be performing provocative tests? Now, when performing a provocative test, I'm talking about a skilled personal trainer or skilled strength and conditioning coach. Any kind of skilled coach that may be working with a lower back pain client, should they be performing provocative tests? So, my thoughts and opinions have changed over the years. And if you asked me this question maybe 2, 3, 4 years ago, I would have said no. But having gained more experience, having become more educated, having worked in the MBA, having worked with many lower back pain clients now, I have changed my thought process and my mindset, and I actually do believe that a skilled or very good personal trainer or strength coach that is working with a lower back pain client should at least be educated in performing some provocative tests. And I'm not saying they have to know all provocative tests, but they should be at least educated in them, or at least have an understanding of one's symptoms and what may trigger their symptoms. So here's why my mindset has changed, because if a personal trainer or strength coach isn't educated about their lower back pain client or whatever their symptoms are. So let's say one is compression intolerant. So they have issues with compression and loading of the spine. So maybe they have a vertebral end plate fracture or Schmorl's node. So does it make sense for that personal trainer or coach to go load them up on a squat with maybe 200-300 pounds? In my opinion, that makes no sense at all, because they would only be making that individual worse, much severely worse. And that could have been all avoided if they maybe just performed a provocative test like a heel drop test, which just involves an individual standing on their tippy toes and then dropping down. And then you're applying about 1.5 times body weight to your spine. If that triggers one's pain, then you'd know, okay, this person is compression intolerant. They shouldn't be doing any loaded compression. We should be avoiding compression-based activities until their symptoms come down or get better. So the key thing to understand, and the key thing I'm trying to say, is that personal trainers or strength coaches are kind of in the front line of movement. They're in the front lines, and they're always dealing with movement. They're dealing with individuals where they're teaching movement, they're teaching squats, deadlifts, all these complex activities and lifts. And if a trainer or coach doesn't understand one's pain triggers or doesn't identify them through a provocative test, then how would they know what to prescribe and what to avoid? So the point being is that if a trainer or coach do about these provocative tests, we're educated about them, they can then have a better understanding of how the program should be structured, and then that would basically help them prevent any future problems from maybe developing in the future or making an individual's case worse. So that's where my thought process is around provocative tests. Now, keep in mind though, only a very skilled trainer or coach should be performing them, and they have to have a lot of experience and expertise and just an understanding of how to perform these tests as well. Because at the same time, performing them, putting someone into pain is not exactly the best thing. It's not exactly what one wants to do, but I would personally rather I'd personally rather put someone in a pain position where they're in an unloaded position as opposed to being in a loaded position. Because if you just start loading someone up in a pain position, that's just going to make things significantly worse in the case of lower back, specifically with someone with a history of lower back pain or injuries. Now that's just my thoughts, guys. I would love to hear what you think about this. Maybe you agree with me, maybe you disagree with me. I would love to hear your thoughts and opinions on this topic. That's kind of where my mindset's at now and what I personally believe. Now, that's also a way that maybe trainers or coaches could kind of differentiate themselves from the traditional playing field as well, and that could make them a better coach or trainer as well. Because at the end of the day, when we're talking about strength coaches, personal trainers, they're in the field of injury prevention. And so we don't want to make one's case worse. So identifying these right off the bat, using maybe some provocative test, may prove to be very beneficial. Now at the same time, one could be working with a physical therapist where maybe a trainer doesn't need to know, but they still should have an understanding of these provocative tests and what they trigger, but maybe the physical therapist performs it, and then the trainer just kind of goes along and maybe works correspondingly to the physical therapist, and they work together. In some cases you'll see that, but for more of an independent coach or trainer, having a good understanding and maybe performing these would prove to be beneficial. So that's just my thoughts, guys. Love to hear your opinions. What do you think? And that's it for this video, guys. So we'll wrap it up, and until next time, I wish you guys all the best and a successful and productive day, and take care.